One of the biggest problems that I encounter with women in their pregnancies is back pain, and pain all throughout their bodies, but specifically back pain. And I would say it's as common up to 50% of my clients. And so what we do is we really try to look at ways that we can help aid in the back pain, but also get to the root cause of the back pain and try to prevent it throughout the pregnancy process. When we look at the different changes, we have to take into consideration each trimester and the changes that are happening. So first trimester, there's so much progesterone that's going through the woman's body. If she's been pregnant before, there's typically some sort of scar tissue that is in her ligaments, round ligaments, broad ligaments. As her uterus and her belly grow to accommodate the growing baby, what we start to see is that scar tissue start to stretch, and that can be very uncomfortable. So in the first trimester, that's typically what we're dealing with. As we move into the second trimester, we start to notice the hormone relaxin that comes into play. Relaxin is amazing for pregnancy. It's amazing for birth. We know that it softens all the joints and cartilage. It's something that we want to have so we can birth our babies. We know that the pelvis can open up an extra 33% to accommodate the birth of our babies with positional changes and this beautiful hormone relaxin that's in there. And so with the shift in the second trimester, now the uterus at 20 weeks is typically at her umbilicus, or her belly button, as we say, and that will start to change the center of gravity. As she gets further along in her pregnancy, what we see is a strain on all of these different ligaments. The sacroiliac specifically is what we see most in the third trimester. So her body is trying to stabilize anything that is pulling her forward with that belly. The most important piece of this as well is that we know when we stabilize the pelvis, when we reduce pain, when we give someone a better quality of life, what happens is we get women that continue throughout their pregnancy in a much better state. We know from research that if a mom is constantly in pain, it's going to decrease her mobility. It's going to make her more depressed, if you will, going in throughout the pregnancy. And so with this product, it's going to improve her quality of life. It's going to improve her outlook on life, and that's something that's really important to me.